Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right wisdom tooth, the lower left wisdom tooth, their approximation to the inferior alveolar nerve, and 3-7 and 4-7. Now we're going to take you to the panoramic view. On the panoramic view, you can clearly see that both the wisdom teeth are in very close approximation, especially the APCs with the inferior alveolar nerve. We're going to take you to the transaxial view, which is basically the proximal view. Now this is the tooth, wisdom tooth. As you can see, this is 4-8. This is the inferior alveolar nerve highlighted with orange. And as we are moving posteriorly towards the ramus, we can see that this is the roots have started now. This is the mesial root, the distal root. The mesial root is just above the inferior alveolar nerve. And as we are moving further distally towards the ramus, the inferior alveolar nerve comes in close contact and then starts to get compressed by the wisdom tooth on the lower right hand side. Now for just better understanding, we're going to remove the highlights to give you an idea. So this is how the lower right inferior alveolar canal should look like. It should be round and with a good cortical plate covering it. But as we are moving distally at the mid root or the apical 1/3, you see that the inferior alveolar canal gets compressed into a kidney bean shape. Now this compression highlights that this is entangled with the roots of the wisdom tooth on the lower right hand side. So this is where we can see that this is the mesial root and this compresses the inferior alveolar nerve right there, and then it actually travels between the two roots, and then as we move further distally, the inferior alveolar nerve resumes its natural anatomy and starts to move up into the ramus. So here we can very clearly see that the inferior alveolar nerve is actually in contact and is being compressed by the wisdom tooth, and any movement of the wisdom tooth will have a direct impact on the inferior alveolar nerve on the right hand side. Now we will take you to the left hand side. So this is the left hand side. Now we're on the left. So again, we're looking at the proximal view. So this is the wisdom tooth, as you can clearly see. And as we are moving distally, we will be able to see this is the inferior alveolar nerve quite inferiorly at this point. But as we are moving further, as you can see, this is the mesial root, the distal root, and the mesial root again comes in contact with the inferior alveolar nerve right there, the canal right there, and the mesial root this time is just underneath. It doesn't come between the roots, but again, if we remove the highlights, you will be able to see that the normal round architecture, the circular architecture, gets compressed into a kidney bean shape by the apex right here, as you can see right there. So this is the mesial root apex, and it is now compressing the inferior alveolar canal. It's not as entangled as the right side, but again it is being compressed, so any movement of the wisdom tooth will have a direct impact on the inferior alveolar canal on the left hand side of the patient as well. So it's inferiorly, and as we move distally into the ramus, you can see then it starts to ascend into the ramus. Now we're going to show you the sevens, and the best view for this is the axial view. Now this is a top to bottom view. On the axial view, you will be able to see the relationship of the wisdom teeth as well. And now you will be able to see that as we are moving, this is very superficial. You can see both the wisdom teeth. This is the inferior alveolar canal. But as we are moving inferiorly towards the apex or towards the bottom of the ramus, you will see that both the inferior alveolar nerves are in complete contact with the wisdom tooth. This is the right hand side, this is the left hand side, and that's how it is. Now if we look at the status of the 3-7, this is 3-7 and the 4-7. So 3-7 has a distal class 2 cavity which has now started. This is the class 2 cavity. The class 2 cavities are not in the crown structure, mind you. They are below the cemento enamel junction here. There we go. Exactly. That's the class 2 on 3-7. This class 2 is in very close approximation to the pulp horn, the distal pulp horn of the 3-7. There's a class 2 which has started in the 4-7 as well, but this is relatively shorter and is not very close to the pulp horns. So this is again something that needs to be kept in mind, that this is the class 2 cavity, these are the pulp horns, class 2 cavity pulp horns. So the right hand second molar is still relatively far away, the cavity is relatively smaller, but the left hand side, the cavity is quite significantly big. So if you have any further questions, please feel free to reach to our team. Thank you very much.